Well, Betsy, now on to some breaking news. The youngest members of our community could soon be receiving a vaccine against COVID-19. Late this afternoon, Pfizer asked the FDA for emergency use authorization for their vaccine for young children. Isabel Lawrence spoke with experts in our area about what this means for families if the authorization is indeed granted.
It's an absolute no-brainer that every kid should get this vaccine.
Pfizer has filed for emergency use authorization for a 2-dose regimen of their vaccine in kids 6 months to 5 years old, with testing continuing for 3 doses. A move doctors hope could be the final blow against COVID.
We need everybody to be vaccinated. We need everybody to be protected. And so long as this population, like under the age of 5, that aren't protected because they don't have a vaccine, this pandemic is going to persist.
The shot could provide peace of mind to parents with fewer options to protect their little ones.
We've been very frustrated by other parents' push to get everything back to normal because our kids aren't protected.
And though the virus often doesn't impact our youngest as severely as it does adults, it still poses a risk.
This resilience that the children had against the virus doesn't really hold up as much with the Omicron strain. And so it is very important that we try to protect them more so now than where we were a year ago.
For families who aren't so sure, the experts emphasize we can trust the vaccine.
And 2 years into this now, we know this vaccine is safe, effective, and is probably going to be our way out of it.
And while mask wearing and social distancing are still crucial tools,
getting that vaccine is the absolute most important thing you can do.
Now, Dr. Amy Edwards says this is turning out to be the most studied vaccine in history and said that her own 3-year-old will be first in line for the shot. But Jay, yesterday I did speak with the Cuyahoga County Health Commissioner. He told me that only 23% of kids 5 through 11 have been vaccinated against COVID. So we can see there's definitely some more work to be done here.
Yeah, obviously age group 18 and under has been much more cautious, and that's because the parents are also involved in those decision making. Isabel Lawrence live on What's New. Isabel, thank you.